everyone. I am Shujan Ghosh, consultant audiologist and speech language pathologist at Neotia Bhagirathi Women and Child Care Center, Newtown Hospital. In the Newtown Hospital, we have a complete audiological and speech language therapy clinic. In the audiological department, we have different audiological tests like audiometry, tympanometry. We have a neonatal and pediatric assessments and audiological tests like we have a BERA test, newborn hearing screening test like OE test are available. If a patient is suffering from conditions like listening problem, hearing problem, then they need to perform audiometry and tympanometry test. Nowadays, infant or neonatal hearing screening program is a very essential and crucial part to diagnose and the intervention strategies for the hearing impairment. For the neonatal hearing screening, OAE, otoacoustic emission test, is very important to rule out the early deafness in the neonates or in the infants. At Neotia Bhagirathi Hospital, we do infant hearing screening program for every neonates or babies. We also done here BERA test for the infant and babies. So once we do OE test, if they have any kind of or sort of abnormalities detected in the OE, we do perform BERA test. It is a basic routine protocol for the assessment of hearing. If a baby is healthy, turned, then OE is sufficient to diagnose their hearing sensitivity. If they have any sort of high risk factors like hyperbilirubinemia or conditions like high risk factors or like any sort of hypoxia or any medical condition, prematurity, low birth weight, or any NICU and SCUBO admitted babies, we both do OE test and BERA test, because OE is not only sufficient test to diagnose the conditions like auditory prematurity or like any sort of nerve related or auditory cochlear nerve related disorders. In the speech language therapy department, we have a speech and language therapies for the speech and language based disability patients. If your baby or child is 2 years of age and yet not speaking meaningful words, they couldn't respond to your verbal commands, then you should consult with a speech language pathologist for their speech and language issues. If your baby is more than 3 or 3.5 years of age, unable to formulate sentences or couldn't speak properly, you should consult with a speech language pathologist. Different speech language disability related issues like autism, attention deficit hyperactive disorders, neurological disorders like cerebral palsy, chromosomal disorders like Down syndromes, craniofacial issues like cleft lip and palate, or tongue tie or ankyloglossia cases, speech therapy is very helpful. Here in the Newtown Hospital, we do have a complete speech and language based rehabilitation setup. We do speech therapy and language therapy for the speech and language related disabilities. We have parent training programs, counseling programs and hands-on session with our patients. In Newtown Hospital, we also have a swallow clinic. If your baby is suffering from conditions like poor breastfeeding, poor bottle feeding, difficulty in taking conditions or like solids or semi-solid, they have a difficulty in swallowing semi-solid or solid feed, conditions like cough during feed or like nasal regurgitation during feed or swallow, they need consult a swallow pathologist immediately. We also do here voice therapy. A patient having difficulty in voice or difficulty or not good quality of voice sounds, aphonics or conditions like hoarseness of voice, choking, pain, then we do a voice therapy also. Okay. And if your baby or patient is suffering from a fluency problems like stuttering, stammering, poor articulation, clutterings, or they have a fluency issues, stuck during speaking, they need a fluency therapy or a speech therapy to improve their quality of speech and quality of articulation or speech clarities. In the speech and language therapy sessions, we consult with our patients regarding those problems. If you people do have any queries related to speech and hearing issues or any speech language related disabilities, we are extremely happy to attend you people and do better service with you people. And finally, once or when you visit any audiologist and speech language pathologist, do check their RCI CRR registration number, which is very mandatory to perform a speech and audiological practices, and it should be mentioned in their prescriptions or in their reports. Thank you for watching.